Are you tired of that annoying phlegm that just won't quit? Trust me, you're not alone. It's a problem that a lot of us face. But what if I tell you that there might be an easy, natural way that can help you out? And it's probably already in your kitchen. Hello and welcome back to Dr. Solar channel. I am Dr. Fatima, and in today's video, I'm gonna tell you how salt can be your secret weapon against respiratory mucus. So stay with me until the end of this video. Let's go. First of all, let's talk about the different causes that can lead to having constant mucus at the back of your throat. The first cause is allergies. In allergies, the mucus is mostly clear and thin. If you have allergy, you might also have itchy eyes, sneezing, and a runny nose. Another cause for having mucus at the back of your throat can be a cold or a flu. With a cold or flu, the mucus can start clear but may become thicker and change to yellow or green as your body fights the infection. You can also have some other symptoms like a stuffy nose, sore throat, or even a fever. The next thing that can be a reason why you always have mucus at the back of your throat is asthma. If you have asthma, you might also experience wheezing, chest tightness, and shortness of breath. And these symptoms are commonly experienced after physical activity or during specific seasons. Another very common cause of constant mucus at the back of your throat is GERD, or simply acid reflux. With GERD, you might have a sore taste in your mouth, heartburn, or a burning sensation in your chest, especially after eating or when you lie down. The next cause is chronic obstructive pulmonary disease, or COPD. COPD is a lung condition that makes it hard for you to breathe, and it's usually caused by long-term exposure to harmful substances like cigarette smoke. In COPD, the mucus is often thicker and harder to clear, and it can be accompanied by shortness of breath and chronic cough. Sometimes some environmental factors, like some irritants or even smoking, can make you have a constant mucus. Alright, now enough with the causes, and let's talk about our magical treatment with saline nasal irrigation. Saline nasal irrigation does two main things. Firstly, it helps to get rid of the mucus and the germs in your nose. And secondly, the salt and the other stuff in the water can help the cells in your nose to work better. The salty water in nasal irrigation pools water in the lining of your nose, making it moist. And this moisture can help move the mucus from your respiratory system. It also helps washing the dried mucus and the dirt from your nose. After using saline, the mucus in your respiratory system becomes thinner and easier to move. And if you can use sea salt for the irrigation, it can help you in other ways too. Ingredients in sea salt can sometimes repair the damaged cells, reduce swelling, help the tiny hairs in your nose to move better, and make the mucus less sticky or easier to get rid of. Alright, now we know that nasal irrigation can be useful, but how should we do it? So basically we have two types of saline that we can use for nasal irrigation. The first one, and the most common one, is isotonic saline, and the other one is hypertonic saline. Isotonic saline contains 0.9% sodium chloride, matching the body's natural salt concentration. It is generally safer and have lower side effects compared to hypertonic saline. Now, if you have more than 0.9% salt in your water, it is called hypertonic saline. Hypertonic saline might be more effective in symptom reduction, but it can lead to some side effects compared to isotonic saline. These side effects include nasal irritation, burning, and itching. So generally, isotonic saline is recommended because it's safer and more convenient. You should use room temperature saline for more effectiveness and more convenience. A saline solution heated to 40 degrees centigrade can also be used, if you prefer it, but avoid using solutions that have been refrigerated or heated above 40 degrees. If you want to make the solution yourself, you can use distilled or bottled water. And if you want to use tap water, you should boil it at least for 5 minutes and then cool it before use. This preparation method prevents retrograde infection. In order to make isotonic saline solution, you should mix 9 grams of salt, which is about 1.5 teaspoons of salt, into 1 liter of water. And if you want to use sea salt, make sure that it's pure without added minerals or iodine. And the last question to answer is that how often should we do this irrigation? Generally, it is recommended to do saline nasal irrigation 1 to 2 times per day. But for specific conditions like chronic rhinosinusitis or after surgery, more frequent irrigation might be advised. And mornings and evenings are the recommended times for doing the irrigation, because morning irrigation can help clear the mucus accumulated overnight. And evening irrigation can clear allergens or pollutants collected throughout the day. Always remember that these are general guidelines, but if you have blood in your mucus or prolonged cough, make sure that you see a healthcare professional, because your health is invaluable and it's always better to be safe and get checked out. Thank you guys for watching until the end of this video. Don't forget to like and subscribe, and make sure that you leave a comment to let me know what you think about this video. Until the next video, bye!